They say knowledge is power, but you need the wisdom to understand what this actually means. Welcome to the Decoding Health Podcast. I am your host, Dr. Urban A. Kiernan. Each week, we will share the stage with renowned experts as we dismantle the black box of knowledge and unravel the complexities of science and its practical applications in our daily life. This show is committed to illuminating topics ranging from personal health and wellness to cutting-edge biopharmaceutical advancements and beyond. Let's get started.
Individuals looking to unlock their true potential should look no further than Restore Health AZ. Whether someone is an elite athlete or a high performer in their industry, Restore Health AZ is there to help them reach new heights. Their groundbreaking restorative injection therapy and anti-aging precision medicine are designed to rebuild health naturally. At Restore Health AZ, they believe in the power of biohacking and regenerative therapies to optimize performance and longevity. Their innovative approach includes treatments like V-cell therapy, which harnesses very small embryonic-like stem cells to promote tissue repair and rejuvenation from within. For those who won't let pain hold them back, Restore Health AZ offers a solution. Interested individuals can visit restorehealthaz.com to take a pain quiz and get a free 10-minute consult with one of their experts. They can experience the future of medicine and revitalize their performance with Restore Health AZ.
Alrighty, welcome back to another exciting episode of the Decoding Health Podcast. I am your host, Dr. Urban Kiernan, and we've got our very good friend, Dr. Keith Lavender, Doctor of Chiropractic Medicine, returning guest onto our show, talking about chiropractic and cervical health. I'm gonna like to call these episodes the Keith Urban Show. So we're gonna have a lot of fun stuff here. So. Let's just jump straight into this. Your area of chiropractic medicine is the Atlas Orthogonal. So just quickly touching on that, let's talk about that view of chiropractic medicine and specifically move straight into the anatomy and how that works.
So my focus is really on the way that the head is sitting on top of the neck. And the whole premise is we want to have your head on straight, right? How many of us have had our parents tell us, hey, you need to get your head on straight? Well, the reality is most of the time when you look at people, if you're people watching, you won't see people walking around like this or like that, but you'll see people walking around with their shoulders off. Their eyes will always be level with the horizon as their brain is in charge of keeping everything straight below to make all this information coming into the brain balanced. The visual input, input from your ear canals, input from your little joints of your spine, make sure everything is nice and balanced. So we work on making sure that that connection between the head and the neck is perfectly balanced the best that it can be.
Gotcha. And very, very important points here is what Dr. Lavender just pointed out, and because of fluid in your inner ear,
right.
That's what helps you. Your body always wants to keep the head perpendicular to the ground. Your eyes are always supposed to be seeing in alignment with the ground, and everything else is compensating below that. So on a previous episode, we talked about differences in leg lengths. Are there certain behaviors that could lead to that, especially around the pelvis? And a common example of that is moms holding babies. You know, they're all cockeyed on their hips. And that will go and throw out structural anatomy at that level. And there's other traumas that somebody might have to do that. Is it safe to say that if a person doesn't have their head on straight, but the rest of the spine, which is meant for mobility, like how many bones are actually in the spinal?
Yes, you have 24 spinal bones.
Gotcha.
And you recall them that are protecting that spinal cord.
Gotcha. And there's a tremendous amount of flexibility.
Tremendous amount of flexibility.
And the two strongest ligaments in your entire body are actually up here in your cervical spine. But that trade-off in flexibility leads to lack of
stability. Yeah, decreased stability.
Gotcha. And so when the head isn't on straight, how is it through the entire spine leading to pelvic adjustments, leading to different leg lengths?
Yeah, so if the head's not on straight and you want to walk, then your brain's going to say, hey, if you can't get this corrected, my head's twisted, the brain's going to engage all the spinal muscles down in an effort to compensate and move your head back to a right position called the righting mechanism, so that now my eye visual input matches my ear canal input, and I can start to balance and coordinate and walk. So people will compensate in a way to shift that head back on straight, and in the process, you see my shoulders are going to shift right away. And if I stand up, my pelvis is going to shift accordingly, and I'm going to show up as a short leg, a high hip, a tilted shoulder from the front. And if you look at me from the side, my head might also jet forward or jet backward based on whatever the brain decides is the best strategy for me to move forward with as little stress as possible.
Got you. And that might manifest itself in a variety of different discomforts, lower back pain,
shoulder pain, neck pain,
Yep.
foot pain, plantar fasciitis.
And so there's a lot of people who try to correct that by getting lifts in their shoes.
Right.
They do that. Now, yeah, that does alleviate back pain. And like I've used those too, but wouldn't a better solution potentially be, not in all cases, but in some cases, going and get that spine back into alignment?
Absolutely. Yeah. And that would be a functional misalignment, right? The body is trying to compensate for something wrong, and putting a lift in there, well, it might help it for a little bit. It's not getting rid of the problem, right? So you want to get right in there and figure out what's causing the problem to begin with. Very few cases do you have people that are anatomically, they grew with a short leg, whether it's in their femur or their lower leg.
Gotcha. But that's normally diagnosed in childhood, I would assume.
Yeah, typically. And you would take x-rays and measure to figure out if it indeed is a problem.
Gotcha.
But the body can compensate. It's amazing. It can compensate for a short leg of an inch. So if you have a real inch short leg, your body is able to compensate for that.
Yeah, and I'm really looking forward to other episodes where we look at the real world application of these techniques and how quickly that your body is able to adjust after an adjustment to it. It's totally going to blow your mind. So be looking forward to that one. But before we get into the actual full vertebral structural aspect of all of this, because there's the manipulation of the bones, there's all of that muscle support. Now, most people, when they think about like back muscles, they think about, bodybuilders and their latissimus dorsi, maybe big traps, like in football players, maybe even rhomboids if you're really educated on your muscles. But there's way more to it than that. Can you elaborate a little bit more on the complexity of the muscle structure in the neck and the back?
We have 3 deep layers of what are called paraspinal muscles that are just muscles that are right alongside of the spine that will connect one vertebra to the next one to 2 below it. And it just is a very unique, tightly held structure to allow for very fine movement control. And even more importantly, it's there to give feedback to the brain about where my spine is in space so that I can have proper movement without causing damage. And that input back to the brain, we call it afferent input. So that's the garbage in, garbage out idea. If your brain doesn't receive the signals that it needs on where the spine is at in space, then it's not going to be able to make a good determination of where we need to move. And many people have had the unfortunate event of moving in a way where all of a sudden they feel like, oh, I just messed up my back, and everything in your body says you have to stop. And that's when that process has somehow become interfered with.
Gotcha. And you're actually talking about like a tight muscle locking.
Yeah.
It's not wanting to release because it's trying to protect itself.
It's trying to protect the structures around it. More often than not, it's trying to protect the fine little nerves. So anything that the body thinks is important, it puts a bone around it, right? So you got the most important structure. Your brain has these 8 cranial bones that keep it protected. Then you've got the 24 vertebrae that are tightly protecting that spinal cord from having any interference to it. The body doesn't want anything touching it, pulling it, chafing it, or messing it up in any way, shape, or form.
Gotcha. And these muscles, like How big are they?
Oh, they can, depending on the individual, right? They're usually very small, right?
Gotcha.
And loaded with fibers that tell the brain what's going on with that space.
Gotcha. And so now, if there's somebody who is very athletically fit, really good muscle tone, they took their shirt off, kind of looked like, Adonis, so to speak.
Yeah. Kind of like your back.
Stop it. Does that correlate with the health of these fine muscles, or are they two
Right.
totally independent things?
They're totally independent. I can find people who have strong, just like you're describing, nice back, and I can do a real quick test to test those fine motor movements and find out that they're not even working.
Gotcha.
And the body instead is compensating with these larger muscle groups.
Gotcha. So it would be safe to say that just because you're training really hard, you've got really good muscle tone, that doesn't mean you are immune to these types of issues. And if there is an underlying issue with those fine little motor neuron groups, because all of this signals back to the brain, is this something that could have a direct impediment on the growth and stimulation of other muscles? Like, they're not just because these little stabilizing muscles aren't able to fire, it leads to the bigger muscles, the ones that people associate with aesthetics. Is it possible that it prevents them from firing properly? So a person who's training, whether it be for just pure vanity or for some sort of athletic type event,
Yeah, performance.
that those larger muscle groups aren't able to fully recruit muscle fiber and firing, which may impede their athletic performance, leave them at higher risk of injury. Is that a safe statement
Yes,
to make?
absolutely,
Gotcha.
absolutely. And many people who are really in tune in that space, they can usually tell that there's a problem with the way things are firing, and can kind of get a sense that they may be compensating in some way that they don't want anybody else to know about, but they know that they have to be careful with those moves.
Gotcha. But again, chiropractic medicine isn't something, it's outside of mainstream Western medicine. So you could go to your general practitioner or even a neuro specialist,
Yeah.
and they might not be able to help you, or might not even understand if you're noticing a problem. Yeah, you might be able to go to physical therapy and be able to do something like that. But what we're talking about is something that we're moving into with your Atlas Orthogonal to help set the tone for everything from the base of the skull all the way down. It might be outside of the scope of what they're actually looking for. And it's not a shot on their medicine or what
No,
they're
not at all.
providing. It's just if they're not looking for it, it's if I wanted to go and haul 3 tons of rock, I would not use a Prius.
Right.
Or
Yeah.
you could try.
You could try, but you just don't know what you don't know, right?
Right.
Just like we were looking at an X-ray the other day, and the place that took the X-ray had a marker on the X-ray, said this is right. Well, I had more X-rays of the same patient, and they had the marker on the wrong side, and they said that this X-ray showed no problems, but it depends on what problems we're looking for. We're looking for fractures, we're looking for tumors, but when we're looking at structure and function, and you saw with me that C2 vertebrae was way twisted off to the left, as it said on the X-ray, but it was actually on the right in reality.
Gotcha.
So those are things that you have to know what you're looking for to be able to comment on it. But just blanket statement that I wouldn't go to chiropractor or chiropractic doesn't work. That's actually kind of ignorant in these days, where you can find a lot of information at the end of your fingertips to learn more about it if you really wanted to learn.
Gotcha. And again, too, what we're talking about are a lot of nuances and dynamics regarding just the beauty of function in
Yeah.
the human body. And it's not just bone structural, or oh, you're pinching on a nerve. Like all of this is important, but now you're looking at that interaction with muscles, and even muscles that you don't even realize exist. So let's do this. Let's go and switch over to your model here and start educating the audience on what this anatomy actually looks like.
Okay.
Hang on.
So what we're looking at here is the base of the cervical spine. There's 7 cervical vertebrae. Each one of these are the vertebrae. And on the front of the vertebrae, in front of the spine, you've got your discs that take up the space between the vertebrae. And the discs are actually, they grow into those bones. So they don't just slip around like you see in my model. You know, they're not just a pad, but they actually grow into it. So they're super strong. As a matter of fact, if you wanted to break a disc, and you're trying to twist the spine, you're probably going to break the vertebrae before you break the disc.
Gotcha.
That's how strong they are. In between, so you got these discs that are in between all the vertebrae, except this one right here. This is your atlas bone from the front. There's no disc between that joint. There's just fluid filled. There's cartilage on top of that bone. There's fluid in the middle that allows that atlas to rotate around the axis, which is that vertebrae there. There's also no disc between the skull and the top of the atlas. And this joint allows your head to move in this position. From the back, you can see there's a set of nerves here that are protected by nothing but the muscles of your neck. There's also another set of nerves that aren't on my model that come out right here, just like that set. So there's 4 little nerves right here that you can literally put pressure on the back of your head and feel. And a lot of times we do that when we're having headaches. We'll put pressure back there and it may feel good to push on. From the side, you can see the rest of the nerves. They're all protected here in this intervertebral foramen. And then you see this structure right here. This is your vertebral artery on the right. And you can see how that vertebral artery comes up, makes a 90-degree turn, comes in through the side of the atlas. It's called the transverse process of the atlas, through that transverse foramen, or that hole. And that artery wraps back around, another 90-degree turn, and it goes right up inside of the brain to form the basilar artery. These are the vertebral arteries, supply blood to the back of your brain. The back, and then of course, we've got this little 2-ounce bone, this atlas, that's sitting underneath this big old noggin, 10 to 14 pound skull that's sitting precariously up there. And so when we look at the way that atlas wants to move, about 45 degrees of rotation right and left is what that atlas should be able to do freely. And after that, the rest of the spine will start to engage and slightly turn a little bit at each level to give us the range of motion that we have. Mm-hmm. Of course, if you have arthritis, it usually shows up in these joints here, and then you'll have decreased range of motion. You hear some cracking or popping sounds in there. Another thing to look at here as I turn this back around. Of course, this is just a model, so we can't have all the structures on it that we'd like, but this is the front of the atlas. There's the vertebral artery again on this front aspect, and you have an internal jugular vein that sits in front of here, and 3 cranial nerves. One that most people will probably be familiar with is your vagus nerve. Mm-hmm. Sits right in front of that atlas transverse process, or that bone right there. So that as you get deviation of that atlas, it can actually start to put some stress on those structures in the skull. Okay, looking at this from the top, you can see, of course, the brain stem and then the spinal cord. And then you can just kind of look at how much space there is between those structures. That space needs to stay open and have no interference in that space. Your cerebral spinal fluid flows around that spinal cord between a sac called the dura. And that dura is I always like to say it's like a saran wrap or cellophane covering where that cerebral spinal fluid will flow through. And it has attachments at the base of the skull and down here throughout the spine that keep that sac open.
And so, looking at this model and the amount of, this junction right here, looking at your atlas, your axis, your atlas, and again, the name of atlas comes from the Greek guy who was holding up the world, because your head is your world, leading through that brain stem up into your brain, and how important all of this is for not just your motor control that you voluntarily do, but all of your involuntary motor control. It all stems through all of this. Now, Dr. Lavender, if you can go and turn that so everybody can see that big hole through the top and the amount of space that's required for not just the spinal cord, but as you said, this cerebral spinal fluid, or CSF, that needs to flow around the brain and goes all the way down to the base of your spine.
Yeah.
In the movement of this fluid. How is that stabilized right here at that opening? Because there isn't a lot of structure, and it is hypermobile, albeit in very specific directions. How is that all held together?
So your dura has what's called a myodural bridge that was recently discovered through a dissection in this area of the spine that hadn't been done previously. But you have muscles that come off of the atlas and the occiput that attach back here to keep that open, that structure open in the back. So when you flex forward or extend backwards, there's no collapse of that area.
Okay. And so those are the little stabilizer muscles that we were originally talking about that give a tremendous amount of neural feedback back into the spinal cord in the brain. Now, your two strongest ligaments in your body are actually up in this area. Where do those actually reside when it comes to all of this?
So it's kind of hard to see on this model, but this is your axis or your C2, and that bone poking out is the dens. There's the atlas. So I'm going to put that atlas down right here. And so the ligaments are on the back side here that hold this all nice and tight to cruciate ligament. So if we were to turn this back around, it's going to be deep inside of here. So it's kind of hard to see because the spinal cord is right in the way, but it holds it right, right deep inside there.
Gotcha. And so these are ligaments.
These are ligaments, yeah. It holds bone to bone.
Yes, and if anybody has ever had a sports injury, torn their ACL, their anterior cruciate ligament, and they have to do surgery to go and put that little puppy back together, I've personally had to experience that. Can people actually break those ligaments?
Yeah, okay. They get broken, and traumatic brain injuries can break them. Falls on the head, injuries bad enough can rupture them.
Gotcha. And so, like, obviously, car accidents, sporting incidents,
sporting events, yeah,
like contact sports, I'm assuming.
Yeah.
Okay.
Contact sports, maybe where helmets are hitting each other, or hitting the ground.
Gotcha.
Yeah.
And if somebody ends up with a broken ligament, are there symptoms, common symptoms behind that? And is there, like in the case of ACL, they put a cadaver or they donor from another part of your body, is there anything that's done for that?
Not in this area of the spine. If you break your neck up here, you're dead.
Gotcha.
Your autonomic nervous system can't function, and doctors aren't going to go in here and try to reconnect those ligaments.
Gotcha.
You're going to have life with a cervical spine instability. Some doctors are putting stem cell injections in through the mouth into that area in the hopes of actually getting those to be recreated. In the case that you may still have a little bit still touching, right?
Right.
But if they're completely ruptured, if that ligament's completely ruptured, it's probably not growing back.
Gotcha. But you could still have a functional life.
Oh yeah, have a functional life. You have, cervical instability will follow. People have difficulty thinking, difficulty concentrating, headaches, difficulty, or they may feel like it's hard to hold their head up, right? Because that gives the stability up there, and a whole host of neurological symptoms can show up based on that individual's trauma that they had.
Okay, so from a diagnostic perspective, because this whole area right here is probably one of the most critical yet overlooked aspects of the human body. How do they diagnose these issues, or are they not diagnosed normally?
Most of the time, following a traumatic brain injury, we're all focused on the brain, right? Making sure that there's no hematoma going on in there, and that the body's not going to die quickly. But after that is all said and done and looks stable, most of the time nobody ever looks below the head.
Gotcha.
And so it's mostly underdiagnosed. Ways that we can diagnose it is with imaging studies on x-ray, especially x-ray that causes some stress like flexion, extension with the head, tilting left or tilting right under x-ray or motion x-ray that will show us that, hey, this isn't behaving the way it should in a normal situation, will give us, by deduction, some ideas that there's a problem up there.
Gotcha. And I'm just going to throw this out here. If you were to go a classical Western medicine approach, because they do x-rays of the neck or
Yeah.
MRIs of the neck all the time. I've had
Yeah.
it done myself. Would those get annotated by, commented on by a radiologist? Do they even look for those types of anatomical differences? Like a radiologist, what would a
Not in
radiologist?
general, not in general. And then they'd have to make sure that the technique that they use to actually image this upper cervical spine is appropriate and they're getting the right amount of slices, the right thickness of slices so that they don't miss it. Because many times, as when you take an MRI, you'll get it in a slice section. One slice, go 4 millimeters, another slice, go 4 millimeters, another slice. And the thinner that they slice, the longer it takes to do an MRI. And depending on the imaging quality of the MRI, you could totally miss the area. And if it's not in a stress position, a flexion or extension position, you may never even see it.
So in your practice, Dr. Lavender, you see people all the time and you look at if they have other images, MRI or X-rays through one of the systems that you can access, and then knowing your practice, you take your own X-rays. What are some of the common things that you see up here that are just grossly overlooked that's very simple for you to key on?
So most of the time, when X-rays are taken from a standard location, you're looking for tumors, you're looking for arthritis, looking for any space-occupying lesion.
So they call that stenosis, right?
Stenosis would be where arthritis or congenitally you've got a narrowing of the canal, right? The space is smaller. So you're measuring those types of things, looking for what I call a smoking gun that may be directly related to a person's symptoms, right? Which is why they go in the first place. But when we look at x-rays, we look at that too, but we're looking to see, hey, what's the alignment look like, right? Is the cervical spine, does it have is it nicely curved, or is it a straight curve or a reverse curve, which is indicative of some previous trauma, which we would like to say that the structure equals the function. If you don't have good structure, you're not going to have good function. Is the atlas tilted left or is it tilted right? Is it pushed forward? Is it pushed backwards? So we're looking at these fine-tuned alignment issues in the cervical spine to see if we can improve it.
Gotcha. And so when just for clarification, when you're talking about curvature of the neck, are you talking about like from the side profile?
Yes, looking at from the
curve?
side, should have a nice C curve.
Gotcha.
Yeah, whereas if you're looking at the spine from the front or the back, it should be perfectly straight, right? Shouldn't be tilted to the left or tilted to the right.
Gotcha. And looking it from the back, because you've got the spinous process on the back that you're looking at. Ideally, it would be a straight line on all of those spiny parts.
Yeah,
going
that's
up.
what people think of as their spine, or these little parts right here. It should be perfectly straight. Ideally.
Gotcha. And so now, what are some of the common things that you like? Do you see like rotations?
So, commonly we'll see these lower vertebrae will be splayed up. They should be nicely open like this. They'll usually be pushed up like this. We'll see them twisted over to the side, left or right. We'll especially see the axis rotated over in one direction, and often we'll find the atlas rotated in the opposite direction, which is not good. It causes a lot of stress at the spinal cord. We'll also see the atlas tilted left or tilted right, and along with that rotation.
Gotcha. And so now, say somebody is chronically dealing with something like this. What would they normally be feeling, or nothing at all?
Yeah, most of the time they're going to be feeling restricted range of motion. They're going to usually have headaches, neck pain. They may feel some radiating pain in their arms or their shoulder. Some people just have a hard time getting comfortable sleeping at night.
Gotcha.
Yeah, I mean, there's a wide range of symptoms that could come from this area. A lot of people have digestive issues when this area is being interfered with because your autonomic nervous system, the area that deals with digestion, area that deals with heart rate, it all happens right up in through here.
Interesting. Okay, so now, obviously, if you're feeling these types of symptoms, there's a way of being able to go in and speak with trained professionals that can do a alternative diagnosis than what you would get from Western medicine, because you guys are looking for things that classical Western medicine isn't looking for, treatment-wise.
Yeah.
What is done?
So the way we treat this is we'll take X-rays of the spine to figure out exactly how this head is sitting on top of that atlas, and we'll come up with angles like you'll probably see on this video. We'll have a picture up there that shows them. But we'll come in here and we'll use a very light instrument that delivers 6 pounds of force to adjust that atlas back in the right position.
Gotcha. And you utilize, what is this instrument called?
So it's called an Atlas orthogonal adjusting instrument. So Atlas, of course, relating back to the name of the bone. Orthogonal is just a fancy engineering term that means at right angles, perpendicular. So the premise is that your head should be sitting straight on top of your neck. And if it's not, then there's something that needs to be done to help it.
That is the way you attack this problem in your school of chiropractic thought.
Yeah.
Now, there are other adjustments that are used by other chiropractors that can do this. And again, in my personal life, I use other types of chiropractic medicine just because of my understanding of this level of anatomy, these types of adjustments, not the rotational head crack. I'm totally fine with that.
Yeah.
Specifically dealing with the atlas and axis, because those are the things that if you truly wanted to kill somebody, that's the point of attack that you will make them, they'll be the last thing they feel ever. That's why there's certain rules in certain, sports regarding stacking individuals up on their necks or applying neck cranks and stuff, because they don't want to damage this area of the neck, and you're putting your opponent in those types of compromised situations. Can you talk a little bit about these different types of adjustments and the uniqueness of the particular technique that you use?
Yeah, so many of the adjustments, everything that we look at is designed to adjust the spine within the normal ranges of motion. So when we actually deliver the adjustment based on the X-rays and the vectors that we figure out through calculations, we place the spine in a side posture position, moving the head up in a particular position, rotating the shoulders. So we kind of preload the neck and the skull so that they're lined up perfectly. And then the last thing that we're going to do is come in here with the instrument, and we're going to tap that atlas right back where it needs to go underneath the skull. That's the way that we address this upper cervical spine. And once that atlas is set in the right position and we bring them back up, we'll be able to come back down here and feel it changes immediately on the pressure over these nerve roots right here. And that's the way that we'll address that upper cervical spine, with the way that we adjust the atlas. And then other ways that we can address it is going to be through a segmental palpation, feeling the way that these joints move. Other chiropractic techniques will allow for adjustments like with an activator or an integrator or by hand to realign the rest of that spine.
Gotcha. Now, are there, again, there's many different providers that can provide different types of approaches to that treatment. Are there concerns that somebody should have regarding what, and again, it's not a shot on anybody's type of approach, but this is a very, very sensitive part of the body. Like, have there been studies that have been done in terms of the amount of force that can be applied to that area before there's trauma?
So with the upper cervical spine, the very early ways of adjusting this back was about 40 pounds of force was put into that atlas on the side by hand, manual hand. And over the years, as most of us guys are, if 40 pounds is enough, we just keep pushing harder. Well, that was one of the premises early on. They realized that that wasn't getting good, consistent results. So today, that 7 pounds of force is through research, they figured out that less is more in this area to produce consistent results.
Okay, so did I hear you right? Original approach is 40
Up to 40 pounds, of force.
that they were applying. How much can that a human body actually take in that area?
Oh man,
realistically?
I don't know how much an adult human body could take right up there, but I suppose, I wish I could tell. I'm not sure.
Have there been any studies where they definitively know that, okay, this will result in, rather than, maybe somebody in the military who's, there are techniques that they teach you in order to intentionally do this to other people. I don't know if,
Yeah.
if you're watching this and you can comment on what that amount of force was, but there is a study in which they looked at stillborn babies.
Yeah, I'm sure that there's a study for adults somewhere, but the only one that I know of that I can think of is studies in infant stillborn babies. Doctors did studies years ago trying to figure out what was going on with these stillborn babies. And they were finding that 40 pounds of force is all it took to sever that brainstem. And they were finding that in those cases back then.
And
Of course, they don't have a lot of muscle, a lot of ligament, strength up there. But that's when you look at the birth process, that's where a lot of these misalignments can happen straight out of the birth canal by pulling on the head, a doctor assisted or forceps or vacuum extraction. And believe it or not, some people think that C-section is less traumatic than a vaginal delivery, and it is not. If you've ever seen one, the head's already most of the time heading down through the birth canal. To get that head back, you've got to go down, grab the head, and twist it back to pull it back up through the incision that's made to get that baby out. Wow. So these are forces that are going on. Neonate's head their whole body weighs 10 pounds at max, right? And we're talking 40 pounds of force. I often like to use the analogy, like if you saw me holding a brand new baby by its head, which is probably, 30% of the weight of the body is in the head. If I'm stabilizing that, how much weight is pulling on that upper cervical spine, right? Maybe 5-6 pounds. That's not that much, but it takes 40 pounds to sever that. And I hate to think about it in this way, but 40 pounds of force pulling on that head through the birth canal is significant.
Yeah. Yeah. Well, it's why back in the day, criminals were given a short drop and a sudden stop because that's all. That's the way this was all taken care of. So, in your practice of your art, there's very mathematically calculated, diagnosed approach to doing. You said it's a 7-pound adjustment. That's done?
Yeah. 6 to 7 pounds force is what we can use to adjust that atlas.
Gotcha. And does it hurt?
No, you don't even feel it. It's a very underwhelming adjustment.
Gotcha.
Most of the time, the worst part is just getting set up in the right position, because it's not just an adjustment, but you have to be positioned in the right spot for it all to work, because these joints are they're so small, and you have to make sure they're all in the right spot.
Gotcha. And from an expectation standpoint, because you just said it's a very underwhelming adjustment. Does that mean there's you shouldn't feel any immediate benefit to it?
Some people won't notice a change right away, but most people notice a change very quickly, especially as it relates to a range of motion difference.
Gotcha. And so, just so the audience knows, I've had this adjustment before, do it all the time. I'm actually surprised with the abuse that I voluntarily inflict on myself during my life, how well my atlas actually holds. You've actually commented on it, but I'm one of those people where I can't feel when my atlas is out. My dear wife, she'll sneeze wrong, and she'll be like, "Uh-oh, my atlas is out." So she's totally in tune with all of this. And again, symptomology, if your atlas is out, common things that people would be feeling would be.
Headaches, difficulty thinking, difficulty concentrating. The head may feel like it's just hard to hold it up, and I don't want to skip over the fact that you can keep your head in alignment regardless of what you put your body through, but your wife doesn't as well. And that's an important thing just based on the anatomy of the spine and the difference between male and female, right? You'll have a man and a woman in the same accident, whiplash trauma. The man will be good within a couple weeks, no pain, no results. But the woman, based on just her anatomy of her spine, she can have worse problems that last longer, especially if they already have a cervical spine instability problem. So that's a pretty common thing that we'll see. And if you do have a cervical spine instability problem and you have ruptured ligaments, the best thing you can do is strengthen those neck muscles and keep your head on straight.
Right. But women don't want bulky necks.
Oh, darn.
No. And to be honest with you, you won't, because in reality, because we already talked about it, the muscles that really matter in all of this are quite small.
They're quite small.
And I know there's products that are out there in terms of being able to strengthen your neck. I have no affiliation with them, but there's a product out there called the Iron Neck. If you are having chronic issues and you go for this type of treatment and you are getting the appropriate alignment and it's helping, but it's unable to stay in alignment, you might want to look at something like that to do on your own as a part of your regular maintenance, because at that point in time, that's the only thing you have is those little stabilizer muscles keeping you from.
Yeah, and this kind of leads into the next thing, right? If you anatomically have those muscles available, doesn't mean that you're actually able to activate them to use them. Because if you've had previous trauma, there's a good chance that your brain has actually inhibited the use of those muscles, and you don't even know it. So that is what kind of pushed me on to the next level of, hey, how do we address and find out if those muscles actually work so that you can strengthen them?
And you're now talking about a completely and totally different set of techniques and technologies. What is this called?
It's called Advanced Muscle Integration Technique.
Or AMIT.
Or AMIT, yes.
Oh, got you. And that's going to be the focus of a totally different episode. Yeah. But why would your body turn off muscles that are essential for, honestly, for life and health?
Right. Yeah. So imagine that you're experiencing a whiplash trauma right now. Your brain is monitoring the stress and the tension of all the structures in your neck, and as your brain is monitoring your head going through this whiplash phase, it detects quicker than you consciously are aware that we're going to have damage to this muscle if we don't relax right now. So the brain will inhibit that muscle from working in the hopes that it doesn't get injured in this whiplash trauma. And if the trauma is significant enough and the signal to the brain is significant enough, that muscle may become inhibited for permanently until inflammation is resolved. If it does get torn, if the muscle does get torn in a whiplash trauma, or you do have soft tissue damage that doesn't heal within 6 weeks of time, by that amount of time, your brain has figured out new nerve circuits to compensate for whatever movement you're putting yourself through.
Gotcha. And so if you've got somebody, pro football player, or even at the college level, because they always put up those headshots and it's like, man, that guy's got a thick neck. If they've got those larger muscles, very mature and developed, are they still susceptible to these fine muscle shutoffs?
Yes, absolutely. Mm-hmm.
Okay. And they might not even know it.
They may not even know it. Yeah.
Okay. Interesting. So a lot of the stuff, again, too, what we're talking about from a structural standpoint, it's associated with pain, pinching on nerves. But we had already mentioned your cerebral spinal fluid, or your CSF. And basically, it's just this liquid that just flows around the brain all the way down through your spine, around your spinal cord. that most people aren't aware of unless they've had the unfortunate experience of having to have a spinal tap. It's not just a movie back from the 80s about a funky hairband. Mine goes to 11. Hopefully you get that reference. If not, you need to go educate yourself as to what that is. Now, the CSF is more important than I think even Western medicine will turn around and give credit to. Now, when we're talking about the alignment, especially around at the base of the neck opening,
Yeah.
and if there is impingement of it, everybody thinks about, oh, pressure on the nerve or
Yeah.
something. Can something actually happen with the flow of the CSF?
Absolutely. And one of our colleagues, Dr. Scott Rosa in New York, has done exhaustive study and continues studying the effect of a whiplash trauma on the base of the brain. Your part of your brain called the cerebellum sits right up in here, and if you have that kind of trauma, they're finding that there becomes a weakness and the tissue that holds your brain inside your skull. And you can actually get some issues where there's a break in this myodural bridge, which holds the dura open right here between the C1, C2. And if that gets broken, then you can start to have some invagination or touching of that dura coming in and causing pressure on the backside of the spinal cord. Or you can have even, just by the way, most MRIs are done in a supine position, right?
Supine meaning what?
So non-weight bearing on your back, right?
You're laying down.
Lying down. And there's a difference when you go from lying down to standing up. I think we would all agree. You get this weight of the head coming back down that can start to cause stress at the base of that skull. And with the atlas being shifted or twisted, you can cause some distortions in the pressure of the cerebral spinal fluid.
Gotcha.
Like I was saying earlier, my colleague, Dr. Scott Rosa, has shown that there can be a Chiari malformation, which is when part of the brain starts to sag or come into this canal, which can also act like a cork in a wine bottle, not letting the cerebral spinal fluid flow in or out properly.
Gotcha.
So it's a change in the pressure gradient in there.
And that's really interesting because through my work at my company, Intrinsic or iMetabolic Biopharma, we actually are developing therapeutics towards Alzheimer's disease. And this is something that in that whole area of science and research they didn't even know about 10 years ago, and that's the glymphatic system. And it is a way in which it's a process in which your body takes toxins that build up in that cerebral spinal fluid. So just remember, your brain has a very high metabolism. Actually, there's on one of Joe Rogan's podcasts, they were talking about chess players that were losing weight during, like high level chess players.
Yeah.
They were actually losing weight during chess matches, and then they come to find out they were burning 6,000 calories a day just from thinking. The metabolic load that your brain and your central nervous system has is actually quite incredible. Now, as a part of that, there's byproducts that are made. Like you work out and you feel, oh man, I'm sore. Well, that's from lactic acid building up in your muscles, and you can feel that. You don't feel any of this stuff in your brain that's building up. And now this glymphatic system, which again, they didn't even know about 10 years ago, it's the system in which all of those toxins are purged from your cerebral spinal fluid into your lymphatic system, which is a different duct system in your body for just getting rid of just crap and garbage that's in there. We're now talking about impingement or restriction of flow of the CSF. Is there any research, or even with your colleagues up in New York who've studied this, regarding an effect of these impingements on that ability to get rid of those toxins?
Yeah, there's research that they've been doing that shows that there's a change in the cerebral spinal fluid flow when before an adjustment, and there's a change after the adjustment. There's actually pressure gradients that change in back of a fluid that you can see in the brain.
Gotcha. And Here's a couple of publications that you've provided, just, providing the science on this, because we want everything to be, again, some of the stuff is anecdotal. There's no way you can have medicine without anecdotal experience. Just
Yeah.
how does this personally, it's very subjective to my personal bias. There's no way around that. That's just a part of science as it is. But there are studies that have gone into this. Now, are there any really profound, like, individual case studies in which this is talked about?
Yeah, well, I mean, the one big one that I'm thinking of is Jim McMahon. You can watch that on the video, and his online. There's a YouTube video of him getting his atlas adjusted, and then showing pre and post flows of his cerebral spinal fluid, and you can see changes in the internal jugular vein is right in front of that atlas. So if that atlas is really jammed forward, it can put pressure on that jugular vein, which backs up flow all the way through the lymphatic system.
Okay, so we're kind of dating ourselves here.
Okay.
Can you explain for some of our younger audience who Jim McMahon actually is?
Yes. He's a professional football player, quarterback.
Yeah. Super Bowl champ, MVP, Chicago Bears back in the 80s.
Another 80s reference.
Yeah, another 80s reference. So that's how old we actually are. But I've seen that video. We are going to be addressing that actually in much more detail later on. But here's a news clip from that entire story, and it's actually really profound how all of these, like, literal moving parts have this, like, it doesn't take place in a vacuum. It's not like you can go and do this one thing and it doesn't have an effect on other parts of the body.
Yeah.
It's just a natural consequence of things. So, back to our audience and understanding that there are resources out there for them. Like, what can people do?
So this type of work is called upper cervical chiropractic specific. So in the chiropractic profession, we represent probably about 5% of all chiropractors. So if you're in an area where you can't find someone that does the Atlas orthogonal technique that I do specifically, you can still look for some other doctors who still have upper cervical chiropractic focus, where you could get some help from and they could get some x-rays done on you.
Gotcha. And in terms of the numbers, because we're here in Arizona,
Yeah.
how many practitioners of your art are actually here in Arizona?
I think there's 6 or 7 of us here still.
Gotcha. Which
Not enough.
That isn't a lot.
Yeah, we need more.
And so where can somebody find you?
So you can find me online at www.foresightchiropractic.com. And I'm also on Facebook. And like I said, I'm here in Arizona. And you can find other doctors that do the Atlas orthogonal work at a website called www.globalao.com.
Gotcha. And I'm sure there's educational information on your website for people to go and read over. And I know for a fact you're very big into, like, site references and stuff. So access to other studies to go and justify the science on this. So now here in Arizona, for any of our subscribers who are here in Arizona, is there anything that Foresight Chiropractic can offer in terms of just getting them evaluated so they know, is this happening to them?
Yeah, so we have really non-invasive ways to assess if you have nerve interference in these areas. And so we call a nervous system test, thermography, surface EMG, heart rate variability, range of motion studies allow us to get a feel and find out if you have the possibility of having these issues. So for your listeners, we're giving a free nervous system exam for these people.
Gotcha.
Just mention that they got it from the podcast.
Yeah, so Decoding Health podcast. How much do you normally charge somebody off the street?
I believe it's $135.
Gotcha.
Yeah.
So it's a $135 value to just go and get checked out to see if this might be a source of your woes and everything. You also offer free workshops.
Yeah. I've always wanted people to understand the why behind the what. So doctors love to have great patients. Secret is patients want to have great doctors, right? Also, so it goes back and forth. And I realized early on that for my patients to be able to stay in alignment longer, get better quicker, spend less money in my office, I had to train them. I had to teach them. So I do workshops every other Tuesday and every other Wednesday in my office to teach them how to keep their head on straight so they spend less money, less time in my office, and get better quicker. And I believe that educated patient makes the best kind of patient. And that's quite frankly where we get most of our referrals from.
Gotcha. And I'll just state this for the record. I'm a patient of Dr. Lavender's, and again, at the very beginning, to go see, I got to laugh, but and this is going to come up more on upcoming episodes regarding this. I originally went to go see Dr. Lavender was to get my wife to stop bugging me to go see Dr. Lavender, and he's proved me wrong. I will tell you right now, I am the worst patient you can ask for because I'm constantly challenging your art because prove it to me scientifically, prove it to me. And this guy gets me every single time. So go and check them out on the web. If you have any comments or questions, write them down below. We'll be able to get back to you, hopefully provide additional resources for you. Really looking forward to having you on the next episode, Dr. Lavender, where we're actually going to see all of this stuff in practice from an upper cervical. And then you had already mentioned the AMIT, like I like to call it, the muscle activation technology, how that works into all of that, and doing that in real life. This is I'm sorry, I can't say it without laughing because it is one of the goofiest things ever. But if I don't believe in it, I'm not going to talk about it. And this is pretty phenomenal. So stay tuned for that episode. Again, Dr. L,
Thank you.
Loved having you on this episode. Looking forward to many more. And let's go check it out, see where resources for you, ask questions, and hopefully you'll be able to find ways to make you and your life better. All right, until next time, we'll catch you then.